Your listeners have extraordinary power if they take a little time to understand and recognize what really works. It's not a statin drug. It's not reducing cholesterol. It's not cutting saturated fat. It's not all the garbage advice that still persists. None of that stuff works.
Dr. William Davis, is saturated fat the cause of heart disease?
It has a small role, but to make it the focus of all your efforts and to launch this ridiculous industry called the statin drug industry, more harm has been done, Dave, from this misinterpretation, misrepresentation, sometimes outright fabrication or lies, or at least exaggeration. So, if I here's the sequence of events in how to cause heart disease. I eat wheat, grains, and sugars. And the reason why that's a concern is there's something called amylopectin A, unique to grains. It's the carbohydrate of grains. And the amylopectin A content has been enriched by agribusiness, by genetics research. And so this amylopectin A is uniquely digestible, extremely digestible. And thereby we know with good evidence that if you look at any textbook of glycemic indexes, dietary book, you'll see that the foods with among the highest glycemic indexes is anything made with wheat and corn. And so the glycemic index of whole wheat bread is among the highest of all foods. So we're told to eat these things, and they not only raise blood glucose to a high level, they also provoke the formation of small LDL particles, the real cause of heart disease, not stupid LDL cholesterol. Total cholesterol values should have been discarded, abandoned decades ago. But let's say I eat wheat, grains, and sugars, the foods that provoke formation of the real cause for heart disease, small LDL particles. And the reason why they're so bad, Dave, is you provoke their formation from wheat, grains, and sugars. They're much more adherent to the arterial wall. They're much more prone to oxidation. They last in the bloodstream 5 to 7 days as opposed to 24 hours after eating something made with saturated fat. If I have bacon, I have large LDL particles that are cleared rapidly. If I have wheat, grains, and sugars, a bagel, a sandwich, whatever, I provoke formation of small LDL that persists for about a week, giving it lots of opportunity to circulate around and implant themselves in your coronary or other arteries and cause heart disease. So the process is initiated by wheat, grains, and sugars. And there's a well sorted out pathway by which this works, comes through the liver. Now, if I have saturated fat, it doesn't cause these abnormalities, it exaggerates them. So if my small LDL particles, let's say I ate a stack of pancakes with syrup, and my small LDL runs from a zero is now 2,000 nanomoles per liter, particle count per volume, and I add butter to the pancakes. Now rather than 2,000, maybe it's 2,400. It's an amplifier. It's an exaggerating factor. It's not the initiating cause. If all I had was butter, I would have nothing happen. Very little would happen. So it takes that initiating factor, the amylopectin A of wheat, grains, and sugars, because the amylopectin A also raises blood glucose. It generates insulin resistance and inflammation, adds to abdominal visceral fat. And those are also amplifiers of this whole thing. So the advice to cut saturated fat, reduce cholesterol, take a statin drug is useless. And it ignores. And in fact, if you tell people eat more healthy whole grains, you've given them the recipe to cause heart disease, ironically.
So that's really interesting because when the advice from the doctor is cut saturated fat, and so everyone traditionally, I grew up, everyone was on a low fat diet. So that low fat diet, all it's done is remove the amplifier. The main root cause is still there.
Yes, exactly right.
Wow. So what causes the difference between 24 hours circulating around for a large LDL particle versus a small LDL particle, which is there for 5 days?
So a large LDL particle has its recognition protein called apoprotein B exposed to the surface, and the liver readily recognizes that particle and clears it, typically within 24 hours. When the LDL particle is small, its surface shape and conformation is altered, and that apoprotein B recognition protein is partially concealed, and the liver can't see it. And so it goes around. That's why it circulates for days and days and days. So this used to happen, Dave, in practice. I'd say, listen, John, you have coronary disease. You survived a sudden cardiac death or a heart attack, or you got a bypass operation or 3 stents or whatever, some form of coronary disease. And he'd start with small LDL particles. This is using something called nuclear magnetic resonance, NMR. It's a very easy technique. It's been around for 30 some years. My colleagues to this day say, oh, it's experimental, or it's not covered by insurance, or some other bullshit answer. That's nonsense. They made that up. You know this, Dave. My colleagues lie all the time or deceive you for the purposes of this is commonplace. This is not exceptional. And this is very, not to say there aren't good practitioners. Of course there are. But there's a lot of nonsense that goes on, especially in heart disease. The reason why is the stakes are so high. There's so much money to be made that this encourages bad behavior on the part of my colleagues. But measuring LDL, small LDL, is very easy. I've been doing it really 30 years. And so you measure it, and then you remove the things that cause it to form, wheat, grains, and sugars, and the amplifying factors, insulin resistance, inflammation. And those are very easy, Dave. A lot of the things in modern life, a lot of the ways we live in modern life cause us to be deficient in things that make insulin resistance and inflammation worse. So we don't get vitamin D because we live indoors. You and I are working right now indoors. We're wearing clothes. If you're like me, I live in the northern suburbs of Chicago, where it's single digit temperatures today. It was 1 degree this morning, so no one's going outside to get sun. So there's vitamin D. Magnesium. We must, in a modern world, filter our drinking water. There's sewage, other garbage in water you have to drink. Filter your water. That removes all magnesium. Iodine, much more of a problem here, of course, where you have inland populations away from the ocean, not getting iodine. People forgot that iodine deficiency was one of the biggest public health problems all throughout human history until 1924, when iodized salt was introduced. And then omega-3 fatty acids, because people have abandoned consumption of brain that has a lot of DHA. And of course, we can't eat all the fish we'd like because of mercury and cadmium contamination. And so we have these deficiencies that, when combined, synergize to amplify insulin resistance and inflammation. So we just correct those simple deficiencies. And now, of course, in the modern world, we've so massively screwed up our gastrointestinal and other microbiomes. And that further amplifies insulin resistance and inflammation. Mostly because when you have a disrupted microbiome, especially if it involves the small intestine. So the colon's bad enough. If you get dysbiosis or disruption of the species composition in your colon, you put yourself at risk for things like colon cancer and diverticular disease and ulcerative colitis and diarrhea and other. But it's when it involves the small intestine, Dave, that's where the real trouble starts. Because what's happened in the U.S., half the U.S. population, Dave, half the U.S. population, 160 million people, have this condition, small intestinal bacterial overgrowth. And all that means, we say SIBO, S-I-B-O. All that means is that because of our exposure to numerous factors, antibiotics, glyphosate probably, which is an antibiotic and an herbicide, food additives like preservatives and emulsifying agents, we know disrupt the gastrointestinal microbiome. So for a variety of reasons, we've allowed fecal microbial species that were supposed to stay in your colon, where the colons can deal with that stuff, but they've overproliferated, then ascended into the small intestine, 24 feet of small intestine. The small intestine is not prepared for that. It's very permeable, has a thin protective barrier. And so when you have trillions of fecal species like E. coli and Klebsiella and Campylobacter and Pseudomonas, when they infest the small intestine, they only live for a few hours and they die. And they release their toxic components into the intestine that in turn enters the bloodstream. That's called endotoxemia. And this has become epidemic. About 1 in 2 Americans now have this. It's also bad in Japan. I don't think it's as bad because there's some habits that the Japanese engage in, like more omega-3 fatty acid in the diet, a little more a warmer climate in many instances. And they get much more iodine, for instance, from their seafood. So there's some differences. But in the U.S., it's horrible. And I didn't appreciate that, Dave, until this came along a few years ago, about 6, 7 years ago. This device, the Air device, AIRE. I have no relationship with the company. The company's called Food Marble. You blow into it, AIRE. You blow into it, it talks to your smartphone 0 to 10 to tell you how much hydrogen gas the microbes in your gastrointestinal system are producing. We can't produce hydrogen gas, but microbes can. So you can use it as a mapping device. Now, I don't want your listeners to think you have to buy this device to do this, but this is how I learned a lot of lessons. When this consumer device came along and people started testing it, thousands of them, it became clear this is everywhere. So what we do is we test to see how soon hydrogen gas is produced. Because if it's being produced in your colon, which is 24 feet down, it's going to take a while to get down there. But what if you ingest something that microbes can convert to hydrogen gas, and it does so within the first 30 or 45 minutes? You know microbes are living in the stomach, duodenum, jejunum. You've got fecal I call it the fecalization of America. We've got fecal material in our small intestines. Dave, it's amazing. We've known these things, but didn't understand what it meant for years. So if you had gallstones and we took the gallstones out and examined it for DNA, you would find the gallstones are filled with fecal microbes. Now, wait a minute. The gallbladder empties into the duodenum, which is 24 feet up from your colon, where fecal microbes originated. How'd they get to the duodenum? And that's 3 times the height of your ceiling. Or pancreatic cancer. If you take a tumor, take out surgically, and then look at it for the DNA, you're going to find fecal microbes in the pancreatic tumor. How'd they get there? SIBO. So SIBO is proving, and that's just gastrointestinal stuff. We now know that this process of SIBO and endotoxemia is a driver of obesity, type 2 diabetes, coronary disease, cognitive impairment and dementia, Parkinson's disease, Lou Gehrig's disease, rosacea, psoriasis, depression, anxiety, suicide, hatred, anger, frustration. In other words, Dave, we've got to rethink all we thought about health in light of the contribution of the microbiome.
So this is very interesting. Like this nuanced perspective about health is very interesting, right? Because for most people, they go to the doctor and the doctor just says, you need antibiotics, or you need a statin, or you need this. There's no looking into things. And I realize, they're under time pressure and all that kind of thing, and monetary pressure. And so how can the average person manage their health? Because the doctor doesn't have a vested interest in managing it.
Sadly, Dave, it's going to take probably 2 generations for most mainstream practicing physicians to catch up with the science. This we've known this for years, right? It takes a long time. They say 20 years, 30 years. It's probably longer than that. And you know what? There's no financial incentive. I tell people, if you're healthy, you're useless to the healthcare system. They don't want you to be healthy. They want sick people. That's how they make money. So this happens to a lot of people in my groups. They say, I went to the doctor and they said, what medications you take? And they say, none. They said, what do you mean none? He said, I'm not taking any. They say, no, you have to take medication. There's this kind of obligatory belief you need to take medication. You need to engage in the medical system for health, which of course is absolute nonsense. The problem is then, if the doctors aren't going to be doing it, I'm generalizing. There are occasional doctors who have made it their business to help people become healthy, but average mainstream MD does not. And they're not being educated about it. Then they'll say stupid things like, oh, we know that probiotics don't work. That is so ignorant, David. It is shocking. So it falls to the individual to learn how to do these kinds of things. If the doctor knows nothing about nutrition and can't even manage something as simple and powerful and straightforward as vitamin D, they screw it up all the time, doesn't know the first thing about how to manage omega-3 fatty acids or iodine, and has no idea how to manage the microbiome. They might say something, well, take a probiotic or some stupid answer like that. If they're not going to do it, it's up to everybody to learn how to do this on their own. You know what? And everyday people can accomplish extraordinary things if you just get a few pieces right. This microbiome part that we've added on the last decade or so is a bit more complicated, but you can accomplish extraordinary things. As you mentioned to me before we started recording, you've heard about what we're doing with Lactobacillus reuteri. This one microbe, Dave, one microbe, this one microbe that we've all lost. So in 1962, Dr. Gerhard Reuter, a microbiologist working in Germany, isolated for the first time in a woman's breast milk. And he made the comment back then, it's everywhere. It's in breast milk, stool, everywhere. And over his 40-year academic career in Germany, he found it increasingly more and more difficult to find. At the end of his career in the early 2000s, he said it's almost gone. And this has been corroborated several times since, that Lactobacillus reuteri is virtually gone from the modern microbiome, even though hunter-gatherer humans all have it, people unexposed to antibiotics and other factors, wild mammals like gazelle and gophers and deer all have reuteri, but we've lost it. So restoring reuteri alone, now I chose to do it at very high counts, because originally when I got hold of reuteri, it was a commercial product at the time, made for infants. And so the number of microbes was trivial. It was 100 million, which sounds like a lot, but in microbes, it's almost nothing. So 100 million, you'd have to take a huge handful of tablets every day to get any kind of effect in an adult. So I just reasoned, how are we going to increase? So let's make yogurt. It's not yogurt. It's a fermentation process. And I developed a prolonged fermentation, 36 hours. So microbes don't have sex, right, Dave? They just double themselves. So reuteri doubles every 3 hours at human body temperature. So I let it double at human body temperature 12 times, 36 hours. I did something called flow cytometry. We did it numerous times to count the number of microbes. It's a laser-assisted method of counting microbes. And we counted 300 billion per half cup or 120 milliliter serving. And that's part of the reason we're seeing these extraordinary effects. We're seeing ladies are seeing loss of skin wrinkles. Guys are seeing a return of youthful musculature and strength. There's an increase in skin moisture. There's a reduction in snacking appetite. There's an amplification of the immune system. There's a shrinkage of abdominal fat. There's an increase in libido. Older guys like our age, get about a 50% rise in testosterone. Ladies get an increase in vaginal moisture and sensation. I mean, well, think about this, man. Smoother skin, more muscled, greater strength, reduced fat, increased testosterone. We're turning the clock back, Dave, 10, 20. Not this bull crap about NMN and, I'm going to live to 140. That's nonsense. That's a fraud. We're seeing youthfulness in the here. If you're going to claim you're going to regain youthfulness, I want to see it now. I don't want to see it in 40 years in the hopes, right, of spending a lot of money for some bullcrap supplement. I want to see it here and now, and that's what we're seeing. We're seeing it in the here and now.
So this will counteract SIBO. This will kind of control the effects of SIBO.
We need to do a clinical trial. We can't do it as yogurt. That's too variable, especially made by people. We'd have to either do it central laboratory and do it or encapsulate. So there's some hurdles here in getting this done. But anecdotally, about 75 people have done this, and 90% have tested to hydrogen gas negative. You don't have to test for hydrogen gas, but that's what we did, just to prove that it was going away. And you have to eat the yogurt for a minimum of 4 weeks. Some people have SIBO so bad, Dave. These are people who say things like, I've been on antibiotics for 3 years, my acne. So those people often have to consume the yogurt longer. And I kind of regret calling it SIBO yogurt because it makes it sound like it's only useful for SIBO. It's not. It's what it is are 3 microbes, 2 minimum, Lactobacillus reuteri, Lactobacillus gasseri, optionally Bacillus coagulans. These are microbes selected for their capacity to colonize, to take up residence in the small intestine. That's where SIBO occurs, and produce what are called bacteriocins, natural antibiotics effective in killing fecal microbes. I was just hoping for some relief for some people who have a lot of problems. No, I didn't expect SIBO to go away. So 4 weeks minimum, And then I encourage people to consume it 2, 3 times per week forever until we figure out. So here's the crazy thing, Dave. If your mom gave you rotari or other microbes at birth with your passage through the birth canal or during breastfeeding, you'd have that microbe for a lifetime, right? If you get it from the yogurt or a probiotic, you're going to have it for a few days, maybe a few weeks tops. Why? Nobody knows, but it's probably that microbes have a community, or we say a guild or consortium of collaboration among other microbes, and they need other microbes to take up permanent residence. So maybe in the future, I'll say, Dave, okay, we're going to replace rotari with these 7 other species, and it will take up long-term residence. But so far, no one's figured that out.
Right. And how, like, is it, this is not just as simple as going to the store and getting some yogurt or something. You have to actually make it yourself.
Yeah, so the stuff in the grocery stores, it's getting better, but it's essentially garbage. So one, it's often sweetened with high fructose corn syrup, sugar. It's often thickened with things like xanthan gum, gellan gum, carrageenan, because they don't ferment long enough. So it's not thick from fermentation. It's thick because of additives. And those thickeners may have consequences for your intestinal mucus barrier. It may dissolve or partially disable your mucus barrier, which increases inflammation in the body. So we don't use those things. And they use microbes that are not very interesting. Typical commercial yogurt is made with Lactobacillus bulgaricus and Streptococcus thermophilus and some other species that, you know what, no one ever said, I bought yogurt at the store and changed my life. No, it doesn't. So we're going to pick microbes for specific effects. It could be rotari for better skin and musculature and libido. It could be Gasseri that shrinks your waist dramatically. It could be Bacillus coagulans that reduces muscle pain from strenuous exercise and accelerates recovery in sports people. It could be Bifidobacterium infantis, that if given to a newborn, that child will be smarter, have a higher IQ, less likely to have asthma and type 1 diabetes and other conditions later in life. It could be Lactobacillus crispatus for a woman who's contemplating pregnancy and doesn't want to deliver a child prematurely and doesn't want to risk miscarriage and wants to reduce likelihood of urinary tract infections over her lifetime. She's going to replace Lactobacillus crispatus. There's amazing things we can now accomplish. It gets a little complicated. At some point, everyone's going to say, enough of these microbes. We're going to have to get like a unifying practice or philosophy or approach so you don't have to ferment all these different microbes. But right now, we're still learning. It's evolving. But your listeners can accomplish extraordinary things by restoring microbes.
If we want to reduce the risks of heart disease, one of the things we could look at is making sure that we take control of SIBO. And you mentioned 4 other things like sun exposure, vitamin D, magnesium, iodine, and omega-3s. Just touching on each of these, I mean, I don't go outside a lot. Like how someone who doesn't get a lot of sun, and of course it's cold, so you're always rugged up. So someone who doesn't get a lot of sun exposure, what should they be doing?
Well, vitamin D is a good start. And what we do with vitamin D is oil-based gel cap supplement at a dose sufficient to raise your blood level to an ideal level that I would regard as 60 to 70 or so nanograms per milliliter. Typically, for a grown man, dose would be about 6,000 units per day. That'd be a very typical dose. So that's a start. Now, vitamin D replaces ultraviolet light exposure in the epidermis of your skin. So, but there's an additive effects. If you get vitamin D and get occasional sun, morning sun, preferably morning sun, you get additional benefits. So one of the things I don't know if this happened in Japan, but in the U.S., we've been told to replace all our lighting with LED bulbs because they require 75 to 90% less energy. And so it's huge energy savings. It's better for the environment. It's horrible for human health because when you're exposed to blue light all day long. So I live in a townhouse. I changed out all the bulb, like 50 of them, Dave, to all LED that emits blue, visible light and blue light. And we now know blue light accelerates cataracts dramatically. It causes a reduction in visual acuity. It increases your likelihood of macular degeneration. It causes you to gain weight Dave, it caused you to gain weight. This is the overexposure to blue. And of course, it disrupts sleep. We all know that because that's why we look at LEDs, computer screens or phones or tablets that are LEDs, and they screw up your sleep. But that's just the tip of the iceberg. And the other part of this is the lack of red and infrared. That's another important thing to get exposed to. So anybody who lives like you and me, who work indoors, I tell you what I did. So I had my desk lamp right here on my left. I had read some years back that LEDs increase concentration in folks. So I replaced my bulbs with two LED bulbs. I started noticing my vision was really deteriorating. So much so at night, if I'm working at night, like 9 o'clock at night, I can't see the screen. I can't read. What the heck is going on here? So I thought about, I'm going to change back to old fashioned incandescent bulbs on my desk. My vision normalized within 48 hours because the incandescent bulbs emit red. That's why when you try to change them, they're hot. You can't touch them. You have to wait for them to cool. That's from red and infrared. So while it's great, it was all done for good purpose to save energy. What I think people should do is if there's a place you frequent, for me, it's my desk, or maybe you have a favorite chair where you read, you want that to be incandescent until the engineers figure out how to make LEDs emit red and infrared. They're working on it, but it hasn't happened yet to my knowledge.
It's really interesting. I'm now a little bit paranoid about this really bright white light that's in my face at the moment. It's um
And of course, these things are helpful too. Blue blocking glass, you can see it looks blue because it's reflecting blue. That helps too.
mm. And so in regards to magnesium, um where should we be taking supplements for that?
You kind of have to because modern produce has as much as 85, 90% reduced magnesium content because the way produce is raised nowadays. And you and I can't drink from rivers or streams that are flowing over rocks and minerals and thereby have some magnesium and other minerals. We drink filtered water. We drink hydroponic or other commercially grown vegetables. We get far less magnesium. And that has implications for weight, insulin, blood pressure, blood sugar, heart rhythm, heart health, a whole bunch of things. And so just getting magnesium it does help. But it's all we're really doing, Dave, and everything. The diet, the four nutrients, and addressing the microbiome. All we're doing is trying to restore life to the way it was supposed to have been and the way it was 10,000, 100,000 years ago. Before we made these colossal mistakes, the adoption of grains, wheat and grains into the diet, processed foods, ultra processed foods, living indoors rather than outside, wearing clothes rather than a loincloth and just fur on your feet. Um, Magnesium because we don't eat wild plants anymore and we don't drink freely running water. So all we're doing is compensating. And this is one of the toughest things for my audience to get a hold of. And that is get away from the idea that the pharmaceutical industry taught you, the way they taught you to think, which is if there's a problem, there's a drug for it. If there's high blood sugar, we got drugs to reduce high blood glucose, insulin and other drugs. If there is high cholesterol, we've got cholesterol reducing drugs. If you've got pneumococcal pneumonia, we've got an antibiotic for that. That's how they think. I'm trying to get people to get away from that kind of thinking. What we're going to do instead is address the factors that allow those diseases to emerge in the first place. And more often than not, coronary disease, type 2 diabetes, obesity, overweight, psoriasis, all that stuff goes away. Even though, so this is a very common experience. Somebody says, I'm going to do your program because I want to lose weight. Because I'm a 52-year-old woman. I weigh 274 pounds. I'm a 5'3" woman, right? So way overweight. She does it and she loses whatever, 130 pounds. And she says, you know what? I don't have hypertension anymore. I don't have prediabetes. My fatty liver is gone. My rosacea went away. My migraine headache went away. In other words, we didn't set out to treat those things. We just set out to restore factors absent or lacking in her life, and she enjoyed a restoration of health. Not to say we address all diseases. So if we were to go to the Brazilian rainforest or the jungles of New Guinea, what kind of diseases did they have? Insect-borne diseases like dengue fever and malaria. They fall off a tree branch and break their leg. And they have those kinds of disease. They have stool-contaminated water and they get some kind of like a diarrhea disease. But they don't have our diseases. They don't have colon cancer or ulcerative colitis or type 2 diabetes or coronary disease. They don't have, so, the anthropologists have called our diseases the diseases of civilization. So they've known for decades that we have caused our own diseases.
But we just continue to go down the same path, right? So like you as you talk about the one drug for one condition, it really makes me think of living in Japan. So it's like there's an earthquake, you get a crack in the wall, and someone says, "Oh, well, we can just fix that. We can put a band-aid over the crack." And it's like, yeah, but that's not solving the problem. That's just taking it out of my sight, you know?
Yeah, or more likely in the US, 50 drugs for one condition
Right.
because it makes so much money.
Yeah. And the drug for the initial condition creates other problems, that there's just this cascade of you need another drug to deal with the side effects and deal with those side effects and the side effects that come from the third and the fourth drug and so forth. So as a cardiologist, how many times were you voted favorite cardiologist of the year by peers at cardiology conferences? Like you kind of you're taking the opposite approach to the mainstream. So like, do you get pushback from peers?
Not a whole lot, Dave. A lot less than you'd think, because this is going to sound cynical, but most doctors don't give a crap about nutrition. They don't talk to people and try to educate themselves. So you'll see this. I've had this happen time and time again. I'll see a type 2 diet. Well, I closed my practice, but when I was seeing patients, I'd get a type 2 diabetic. I'd show her how to, follow a diet, address those nutrient deficiencies, etc. And her hemoglobin A1C, that measure of long-term blood glucose behavior, drops from a terrible 11.7%, a level at which she's heading for kidney failure, um, uh, uh, dialysis, stroke, heart attack very quickly. Well, she does all this. It drops to 6.1%. We get off all her medications. It finally drops below 5%. And I'll get a call from the primary care doc or the endocrinologist. Who are you to take my patient off? I said, well, did you see her hemoglobin A1C is better now than it was on drugs? They usually hung up on me because it wasn't that what I hope my colleagues would say, well, gee, that's curious. Tell me more. Did I overlook something? Is there something here I could learn from? Instead, they say, it doesn't compute. So when they hear these kinds of things, more often than not, doesn't make any sense. Or they say, "Oh, Dave, have you consulted Dr. Google again?" Or, "Hey, who's got the degree here? You or me?" You know all the bullshit answers that my colleagues have, and so they dismiss it more often than not. Optimistically, Dave, but more recently, I'm seeing more and more doctors of a variety of sorts coming to me, and there's other people trying to talk about these things and saying, "Hey, clearly, what we're doing in healthcare is wrong. It's ineffective. It's ridiculously expensive. It hurts people. Look at the GLP-1 agonist nonsense. The FDA approved these class of drugs: Wegovy, Ozempic, Manjaro, Zepbound, stupid names. Uh, and so imagine this, Dave. I'm not sure how this works in Japan, but in the US, your wife pays $12,000, $15,000 for the privilege of injecting herself with this drug for a year. She loses 40 pounds, of which 30 pounds is fat, 10 pounds is muscle. And she stops the drug because most people can't afford that forever. She regains 32 to 34 pounds of fat, not muscle. She's now more prone to prediabetes, diabetes, heart disease, breast cancer, uh, dementia than she was at the start. Yet she put thousands of dollars into the pockets of the pharmaceutical industry to have that. And she's going to die younger. That's the rock in a hard place situation for people who have a lot of weight problems. If you're obese, you're going to die younger on average, like typically 8 years. If you lose weight by cutting calories, such as accomplished with a GLP-1 agonist, you're going to die several years earlier than you should have. The reason for that is when you lose that muscle, when you lose that much muscle, even 10 pounds, think about 10 pounds of ground beef on your kitchen table. It's a lot of beef. It's a lot of muscle. And now you're more prone to fractures, falls, frailty, loss of independence, and early mortality. This is the disaster created by the short sighted thinking of the FDA and conventional physicians. When the reality is, Dave, you can, as you see in Japan, you can be slender. You don't need a drug to accomplish that. And you can be healthy. And type 2 diabetes goes away. The vast majority of coronary disease goes away. All these conditions just no longer take root. And you're slender and youthful.
Hmm. I think the evidence for this is like just staring us all in the face if we look a little bit critically, right? Because you look at every other species of animal, right? Every hippopotamus looks the same. Every giraffe looks the same. Every elephant, every tiger, they all look the same. There's no obese ones. There's no anorexic ones. There's no ones with back conditions. It's but it's only us. And what do we do differently?
Absolutely right. It's all around us.
So just to step back a bit to the four things that you mentioned. So there's the sun exposure, magnesium, iodine. How do we get iodine? Should we just eat more seafood?
That would be one way. It's not the safest thing anymore, is it? Because you have mercury contamination of seafood, you have cadmium contamination of shellfish, and it's becoming an increasingly limited resource because of overfishing of the ocean. So it's becoming more and more of a problem. So this is, Dave, if you went to Paris or Rome and looked at the statues and paintings from people in the Middle Ages or the Greek Empire or the Roman Empire, you'll see a lot of them have goiters enlarged thyroid glands from lack of iodine. So this has been a problem all throughout human history. So when it was recognized by the FDA in the US in 1924, other agencies around the world around the same time, that it was all due to lack of iodine, FDA and other agencies said, all right, the population in 1924, a century ago, was illiterate, mostly illiterate. There was no internet, no TV, no radio. How do you broadcast this to in the US, they launched a poster campaign. Use more iodized salt. They asked the salt manufacturer to add iodine. Use more iodized salt. Keep your family goiter free. People listened. Americans developed a taste for salt. So there was goiters went away. Goiters from lack of iodine. Before that, so if your great grandma was still around, Dave, you say, great grandma, tell me about goiters when you were a little girl. She would say, Dave, you wouldn't believe it. My next door neighbor died at age 18. She suffocated from her goiter. My teacher died in horrible heart failure. She gained 180 pounds and then died in heart failure in a coma. This was a huge problem. It went away with iodized salt. Now, the change in diet, a lot of it due to misguided dietary guidelines. Cut your saturated fat, eat more healthy whole grains, the proliferation of processed, ultra processed foods, soft drinks, all that stuff led to insulin resistance to become epidemic, which causes sodium retention. The FDA interpreted that as overuse of salt when it wasn't. It was diet gone wrong and some other factors that caused sodium retention. So they came out and said everybody should reduce their salt. And they went to the opposite extreme, advising severe salt restrictions, so much so the American Heart Association advises 1,500 milligrams of sodium per day, which, by the way, is a fatal level. You actually die. People die more, but they still stick to that ridiculous advice. So the pendulum swung from one extreme to the other. But the solution is so simple, Dave. Just in Japan, you got wakame, you've got nori, you have all kinds of seaweed and seafood. So it's much easier in Japan. In fact, you can go to Hokkaido and become iodine toxic because the kind of kelp they consume has 20,000 to 30,000 micrograms of iodine. You can become iodine toxic. So the problem may be the opposite. So the average Japanese gets about 3,000 to 3,500 micrograms. In the US, we're talking about 150 micrograms per day of the RDA, the recommended daily allowance, which is just enough for an adult to not have a goiter. That's not what we're trying to do, though. We want ideal thyroid function. That's probably more towards 300, 400 micrograms iodine per day, a tenth of what you get in Japan, but about double for 3 times more than what you get in the average American. Kelp tablets would be one way. Dried seaweed tablets is how we would do it in the US.
Dried seaweed tablets. So how about like people talk about iodine drops like Lugol's and that kind of thing? Is that okay?
You can get iodine drops like potassium iodide, but never use Lugol's or some of the other. There's this fiction, very dangerous fairy tale being passed around that if some iodine is good, a whole bunch is better. This is nonsense. This is absolute utter nonsense, very destructive. People say, people are often enticed by upfront results, not recognizing their long-term consequences. So one of the if you take a mega dose of iodine, say as Lugol's, 12,500 micrograms, or some people are taking 20,000, 30,000, non-physiologic, far more than your body needs, several things happen. First of all, you wipe out the SIBO because it's antimicrobial. When Dave was a kid, he skinned his knee. Mom put iodine on his knee. It's an antimicrobial. When you take so much iodine, it overcomes your gastrointestinal capacity for absorption. It kills off microbes. So that's the good news. It kills off the SIBO, the invading fecal microbes in your small intestine. The bad news is you will become iodine toxic. I've seen this happen countless times. People listening to that nonsense about high dose iodine. This happens in Hokkaido all the time. 20,000 micrograms or more. They have to stop eating seaweed, and you have all kinds of thyroid problems. But the first sign will be that you're starting to get cold, you're gaining weight, your skin is dry, your hair starts to fall out, and then that's iodine toxicity. Iodine toxicity shows up as hypothyroidism. So it's all the same as just hypothyroidism. So you got to stop the iodine. It takes several months or longer for the iodine to kind of dissipate and you regain control of your thyroid. So iodine toxicity is a real thing. I've seen it many times because of this nonsense about high dose iodine.
Just to clarify, the drops are okay as long as you're not going, as long as you're not having more than a recommended dose, or you're saying we should avoid the drops altogether.
Well, the low potency drops you buy in a health food store, like 100 micrograms per drop or 300 micrograms, that's okay. When you get to the Lugol's and some of the other preparations where you're getting more like 12,000, 20,000 micrograms in just a few drops, now you're really risking, and there is no benefit to taking high doses of iodine. That's a fiction,
Yeah. Thank
sadly
you.
propagated by some of my colleagues.
Right. Um, wow. So the final thing you'd spoken about was omega threes. So what's the best way to be getting the right amount of omega three in our diet?
If it was 100 years ago, it would be eating seafood and shellfish several times per week. Now, well, that's still the practice in Japan. As you know, mercury toxicity is a very real thing, and it's happening. So you can only eat fish once, twice per week, maybe something like that. If you get cadmium from shellfish, the cadmium does not leave your body. That's the problem. It stacks. Every time you have an exposure to shellfish, your tissue cadmium levels go up higher because your body does not clear it. So these are real problems. So in our world, we consume occasional seafood and shellfish. Then we have to rely, it's our modern workaround. People don't want to eat brain anymore or tongue or stomach. So how do we get collagen? Got to take a supplement to get it because we can't do it the old fashioned way. Same thing here. We can't get omega 3s because no one wants to eat brain anymore. And it may be unsafe to eat brain anyway. And we can't eat all the fish we want. So we resort to omega 3s. Now, the thing is, omega 3s went through a very, very confusing period. There are a series of epidemiologic studies, like in the Inuit, Eskimos, Japanese, right? Populations that had habitually high intakes of omega 3, and they had fewer cardiovascular events like heart attack and sudden cardiac death. But that's epidemiologic. It doesn't prove cause and effect. So there are a series of trials. One of the biggest was Gissi Prevenzione, 1999, Italian, 11,000 Italians, got 1,000 milligrams, very low dose of omega 3s, and there was about, I think, a 10% reduction in cardiovascular events. Then there was a series of sloppily done small studies. There are all kinds of methodologic problems in a lot of that stuff. For instance, low dose. I remind people omega 3s are food. What if I said, Dave, eggs are good for you, and an average large egg weighs 60 grams? I'm going to allow you 1 gram. 1,000 milligrams, a 60th of an egg. You're going to say, nothing's going to happen. It's a food. People get confused because the pharmaceutical industry has tried to persuade you and me that omega 3s are a drug. They're not a drug. It's a component of food. And whenever you talk about food, you have to talk about much higher quantities. So if you want to have that egg, I'm going to say, Dave, get 60 grams or more of eggs per day, maybe even 360 grams of eggs per day, because it's a food. Same thing here. We're going to talk about omega 3s as a component of food. We need higher quantities. Unfortunately, there was a series of studies done with very low quantities, sometimes 200 milligrams, zero point 0.2 grams. And they say, we don't think much happens. Well, no surprise. You're using teensy weensy doses. Another thing to factor in is overweight people almost show no rise in blood levels of omega 3s. So, a slender woman, a heavy woman, the slender woman have a dramatic rise in blood levels of omega 3s. Overweight women, almost no rise or very small rise. That and numerous other methodologic problems caused us to go between 1999 and about 15 years afterwards, small studies that suggested no good effect of omega 3s. Then better science came out. The active study, the prove it, the hearts, the evaporate, that showed not only do higher doses of omega 3s work dramatically to reduce cardiovascular risk, they also facilitate regression of coronary atherosclerotic plaque. In fact, the most recent trial, the evaporate, this was done with CT coronary angiography. I did CT coronary angiography 15, 18 years ago, and the software was too primitive back then. But now it's better, and you can quantify precisely in 3D space the amount of fibrous tissue, amount of fatty tissue. It's the fatty tissue that erupts and kills you. Amount of calcium. You can quantify precisely. And in these two trials, people who took a statin drug alone had progression, worsening of their disease. People who added fish oil to the statin drug achieved regression of their disease. So the distinguishing is not the statin drug, it's the fish oil. And of course, we now know with good evidence that the omega 3 fatty acids from fish oil slow or prevent cognitive impairment, dementia, because the brain is largely DHA. It reduces the likelihood of autoimmune diseases. It reduces triglycerides and has numerous benefits. But you have to go through all that murky period where there was a lot of sloppy data.
So if you can you just go out and buy a whole load of fish oil tablets and fish oil supplements, and that's good enough to be taking those day to day?
Yes. Yeah, there may be small incremental benefit to obtaining fish as you can. It's much easier for you in Japan than it is here. But eating fish to some degree is going to be helpful. But you can just take fish oil. But the science is telling us clearly that the doses used previously were too low. And I tell people a minimum of 3,000 milligrams per day of EPA and DHA. And you got to get both, by the way. There's also this pharmaceutical nonsense. There's a drug called Vasipa. It's pure EPA, no DHA. So they showed in a trial that 4,000 milligrams of EPA alone reduced cardiovascular events by 25%. But here's the thing, Dave. What if you took Vasipa and you're paying hundreds, maybe thousands of dollars per month for that brand of fish oil? It's fish oil. It's a component of food. And you say, but I want to be sure I protect myself from cognitive impairment and dementia. You got to go buy fish oil that has DHA. That's how stupid the Vasipa is. If you want the cognitive benefits of DHA, you got to add fish oil to your Vasipa.
So yeah, I'm always skeptical of these trials where there's like a significant reduction in anything, because it from the statin trials, like it's all relative reduction, right?
That's right. Excellent point. So a lot of the statin drugs are built on this fiction of relative risk reduction. Exactly right. And there's all kinds of problems with that statin world, including that statin drug trials are largely paid for by statin drug manufacturers and their consultants. So there's a lot of nonsense in the statin drug world. Not to say they don't have a small benefit as well as serious side effects. So we know that the likelihood you're type 2 diabetic on a statin drug is dramatically higher.
So just as you were talking about fish oil there before, you mentioned CT angiography. So if a patient wants to assess like where they are with their heart disease. What is the best way to assess like plaque? Is it through a CAC score? Is it through CT angiography?
It's still a plain old fashioned coronary artery calcium score, as you say, CAC score. So I started doing that after my mom died of sudden cardiac death after her two vessel coronary angioplasty in New Jersey. I had just moved from Cleveland to Milwaukee to set up cath lab, new technology in cath labs. And my mom dies of the disease that I was managing. So that was the kick in my head to tell me what we did in the cath lab to open arteries was inadequate, was grotesquely inadequate. And so I asked myself, this is 35, 40 years ago, what could I have done to my mom? What could I have said to my mom 2 years, 5 years, a decade ahead of time? Said, all right, we know there's a heart attack or death in your future. What can we do now? Now, so I set up a device in Milwaukee. It was one of the first in the Midwest, one of the first in the country. And we started scanning people. It still works, Dave. It's a very good test. I've had many conversations with my friend, Dr. John Rumberger. He's the guy who developed the whole concept when he was at Mayo Clinic. And of course, Arthur Agatston of South Beach Diet fame systematized the scoring of calcium, the so-called Agatston score. So even though that test is kind of old now, I can tell you, I've had many battles over the years with my colleagues who they say, we don't care about hard plaque, we only care about soft plaque. No, calcium is an index of total plaque, and it's a great test. So you want a score of 0, of course, but if you have a score of, say, 400, we know if you did nothing, that score is going to increase 25% per year. So a year later, 500, year later, 625, and you get closer and closer to dying, having a heart attack, sudden cardiac death, need a procedure. So we helped publish these data 20 some years ago. What happens if we put you on high dose Lipitor, baby aspirin, low fat, low saturated fat diet, exercise program? How fast will the score go up? 25% per year. It's almost a cruel joke, Dave. And yet my colleagues to this day, still call it optimal medical therapy. It's laughable. And so way back when, I have people freaking out on me, right? In Milwaukee. What do I do? My score's going up. My cardiologist says I need a heart catheterization and preventive bypass surgery. Even though I ride my bike and swim and go for walks, I have no symptoms. This goes on all the time, Dave. That is malpractice. It's unscrupulous. It's dishonest, but it's done all the time. When the money payoff is so big, even my colleagues will do things just for the payoff. Well, what do you do? Well, it took some years to figure this out. I published some of these data. When you add vitamin D, for instance, it was the first time I saw scores stop going up and dropping. A score of 700 would drop to 482 or something like that. Addressing endotoxemia, big factor. Fish oil, big factor at higher dose. Elimination of the small LDL particle triggered by wheat grain sugar consumption. So these are spectacularly effective things, but they're almost free. And there's nobody making tons and tons of money by dispensing, say, the diet or vitamin D or getting rid of your SIBO. So, but that's the downside. The upside is this means your listeners have extraordinary power if they take a little time to understand and recognize what really works. It's not a statin drug. It's not reducing cholesterol. It's not cutting saturated fat. It's not all the garbage advice that still persists. None of that stuff works. And we now know that's why your hospital may have added an $80 million new cardiovascular wing, because it's such a big moneymaker. And even though in the US, 80 million people take statin cholesterol drugs, there hasn't been much reduction in heart events. And the hospital continues to exploit heart disease as the number one moneymaker for their system.
Yeah. Like in anything, it's very hard for the individual to get to the truth, because there's so much vested interest in saying, "Hey, no, don't worry about the truth. Look over there."
And in the US, I think it's much worse in the US, largely because of direct-to-consumer drug advertising. So what's happened in the US, Dave, is we have all those big pharma companies funneling a ton of billions of dollars about $6 billion or more now into major networks, broadcast and cable. And so what happened about 2015 is all those major networks, ABC, NBC, CBS, all of them said, we're not going to host any more conversations with people like you. We don't want you bashing the pharmaceutical industry. We don't want you talking about natural methods. We don't want you talking about this deep systemic problems in healthcare. We're not going to talk about that anymore. So if you watch American TV, you'll see there's almost no reporting, zero, on anything bad in healthcare. They'll talk about the newest heart transplant or something that makes the medical system look like heroes, but they won't talk about the problems in healthcare. They don't want to hear it because it's against the interests of their advertisers.
It's terrible. So what advice? Most of the people watching this interview are people who have given up the grains, got rid of all even the vegetables and that kind of thing from their diet. And when they do that, inevitably what happens is their LDL will go up. And so they're just eating a diet that's basically protein and fat. So their LDL goes up. They go to the doctor. The doctor says, oh, your LDL's gone crazy. You need to go on a statin. And so they're in this place where they're fighting with their doctor. They risk their doctor kind of sacking them, that kind of thing. Why does the LDL go up like that when they get rid of the carbohydrate? And also, how can they have a rational conversation with their doctor to say, look, I don't think I need to be on this statin?
All right, lots there, Dave. So, for one, the calculation, the equation used to calculate your LDL cholesterol, it's not measured, it's calculated. It's called the Friedewald calculation. And that equation we know is so crude. It was developed in 1958. 1958, Dave. We know that equation is invalidated by any significant change in diet. This has been known for decades. So when you change your diet, it invalidates the calculation sucks to begin with. Now it's even worse. And so it's a fictitious number and it's invalidated when you make any kind of dramatic change in diet. But another thing that happens when you cut out the carbs, wheat grains and sugars, LDL particles become large. And if you were to track side by side cholesterol values and lipoprotein measurements, that is the actual particles in the bloodstream, you'll see when you go wheat grain sugar free, or you might call it carnivorous or ketogenic, whatever, you'll see small LDL plummet and large LDL go up because the particles become larger. That's a very low risk situation, but it's interpreted because of this fictitious number of this invalid equation. It looks higher and worse. If you get those people to track their carnivore calcium scores, you'll see if they start with 0, they stay at 0. If they start at 400, they typically drop their score, provided they're doing other things like vitamin D, omega-3 fatty acids. So the reality is, Dave, that people have enormous control. And this is very sad, the last person to ask on how to manage cardiovascular risk is the doctor. They don't know because they've drunk the pharma Kool-Aid for so long. They think the only thing you can do is take a statin drug or equivalent and cut the saturated fat in your diet. It's so outdated. It should have been discarded years ago, but it's so deeply ingrained in their brains that it's going to take a long time to undo this mess.
So how can people reach out to you? How can people find out more about you, Dr. Davis?
Well, if they're interested in the whole idea of cultivating rotari and gasserai and Bifidobacterium infantis for children and Lactobacillus crispatus for vaginal health, that's all in the Super Gut book. It's also in my blog, williamdavismd.com. I also have these kinds of two-way conversations, typically once per week for a couple of hours. We have 70, 80, 90 people come on. We talk about. People say, oh, my first batch of yogurt didn't come out right, or I don't understand the whole vitamin D thing. And we talk about these kinds of things. So that happens in my long name, innercircle.tv. drdavisinfinitehealth.com. It's a membership website, but we put a lot of time. There's thousands and thousands of articles, videos, forum posts. We also have an artificial intelligence platform there where you can ask questions relevant to the program. If you ask things like how many stars in the universe, it won't tell you. But it can ask you things that are relevant to the program, and it gives you incredibly detailed answers, including all the references. So, and of course, there's Facebook, Instagram, all that kind of business.
No, no problem. Well, I'll link to all of your socials and your website and the inner circle below. Um, Thank you so much for coming on today, Dr. Davis, and
Thank you,
sharing
Dave.
your experience. I really appreciate your time.
Thank you.